Continuing then with our topic on health, quality of life, right? I'm going to talk to you a little bit about nutraceuticals for skin health. Many patients come to the office. Doctor, is there anything I can be using to maximize my results? There are patients who like, a nutraceutical. So I'm going to tell you about some things we can prescribe to improve the patient, remembering that, well, I won't force all patients to use them. The patient has to be in the right mindset to use this, because if you prescribe this right away to some patients, they might think you're prescribing too much, get bothered, and end up using nothing at all. So there is a right time for you to start prescribing after the patient has achieved good stabilization, or if a patient comes in and asks for it right away, then that's fine. You can prescribe it, but never offer this treatment right off the bat, okay? So let's go. So how can compounds, right? How can these bioactive compounds complement dermatological treatment? These are nutraceuticals. So the definition and importance of nutraceuticals, therapeutic foods. Nutraceuticals are foods with a therapeutic function for the skin, used as a complement in the treatment of various skin diseases. The main effects offer benefits in photoprotection, skin brightening, antioxidant action, and anti-inflammatory action. And as a complementary approach, they work as allies to conventional treatments, enhancing results and promoting skin health from the inside out. So we have here the use of oral photoprotection. We have remembering that it is not a pure photoprotector. You can't just take a pill and think it will protect you. So it has to be the combination of the topical, right, with the oral. Neutralization of free radicals, combating oxidative stress induced by ultraviolet radiation, DNA protection, which will reduce genetic damage in skin cells, and preservation of the extracellular matrix. So photoaging, just so you have an idea, is responsible for up to 80% of visible skin aging. Just look at your arms and see how your arms are darker than your abdomen, okay? So all that sun, if a person uses their body to sunbathe, that's it, it's going to age for sure. It will increase the production of metalloproteinases, of enzymes that go, cutting, mincing your collagen and elastin fibers. So you're going to get older. There's no way around it. A colleague of mine sent her to my mom for a consultation. She said, look, I'm sending her to you because she's a dermatologist, but for me, she's no use. She doesn't listen to me. The woman loves sunbathing. She was completely covered in lesions, in keratosis, But for those who want to sunbathe, that's fine. If she wants to do that, she's wearing a layer of the protection of her life is her skin. The skin is meant to protect, right? But excess sun makes the skin more shriveled, wrinkled, aged. 80% is the sun you get. So avoiding exposing your skin too much will protect you quite a lot. And if you don't apply sunscreen here in this area of the ear, of the face, which is a region where you get a lot of sun, where you're always receiving the sun's action here all the time, you will age more. That's why some people age more, others age less, because they protect themselves. Some people have good genetics, but 30% is the sun. Yeah, and if the person is very fair-skinned, obviously this 80% will super accelerate in them. So compounds like carotenoids, polyphenols, vitamins, antioxidants, they form a protective network that acts on multiple levels, from the absorption of ultraviolet radiation to the repair of already established damage. So omega-3, yeah, it has an interaction with anticoagulants. This table is very important, okay? So it potentiates the anticoagulant effect. Resveratrol with statins, because some people think that just because it's natural, it's not a problem, but it is a problem, okay? It causes an increase. It causes an increase in the risk of myopathy. Zinc with quinolone antibiotics, especially reduction in antibiotic absorption. Probiotic with antibiotic, reduction in the efficacy of the probiotic. Vitamin K with warfarin, antagonism of the anticoagulant effect. So these interactions are very important for you to know, so you don't think that everything is normal. So the interactions between nutraceuticals and conventional medications represent a critical aspect of safety in prescribing. It is essential, therefore, to conduct a detailed anamnesis and ask what you use, because usually the patient only mentions allopathic medications. They don't mention the vitamins. So the bioavailability of formulations. Today we have advanced technologies, so liposomes, nanoparticles, products, vehicles that manage to have better efficacy, a superior action. We have pharmaceutical forms, capsules, tablets, powders, liquids, synergistic combinations, and absorption factors. So, bioavailability is a critical factor in the efficacy of nutraceuticals. I like to always prioritize things bought ready-made, right? But we don't have a lot of things. There aren't many things bought ready-made yet, right? But when we travel abroad, we see that there are industrialized products in greater abundance than here, okay? So curcumin, resveratrol, and quercetin naturally present low bioavailability, but these modern pharmaceutical technologies can significantly increase absorption and clinical efficacy. Liposomal formulations, nanoparticles, and micellar systems can increase bioavailability by up to 20 to 40 times compared to conventional forms. So, combined protocols. You can combine nutraceuticals with procedures, combining oral supplementation with peels, microneedling, laser accelerates recovery, nutraceuticals plus cosmeceuticals, an inside out approach, right? With nutraceuticals being inside in and cosmeceuticals being outside in. It offers superior results in conditions like melasma, photoaging, and acne. And this integrative approach of combining aesthetic procedures, cosmeceuticals, and lifestyle changes, this is the dermatology of the future and of the present. Monitoring and follow up are fundamental. Irregular follow up every 30 to 60 days. When the patient undergoes procedural protocols at the clinic, we have the ease of meeting with them more frequently. Nutraceuticals can also act by neutralizing reactive oxygen species, inhibiting melanogenesis, stimulating collagen, and improving the skin barrier. Sun exposure, we have UVA, UVB, and UVC radiation, okay? What do UVB and UVA cause? Inflammation, oxidative stress, and chronic inflammation in the skin. UVB burns the skin and UVA ages the skin. Photoaging will be, what will the final result be? Wrinkles, sagging, and pigmentary changes in the skin. And there is also that anti inflammatory action, the activation of NFQB, and an increase in inflammatory cytokines, such as interleukin 1, interleukin 6, and TNF. So, sun exposure also, it has an anti inflammatory activity, okay? Mild, but it can also cause a lot of inflammation if you get a large amount. And the induction of metalloproteinases, which are those enzymes that degrade collagen and elastin. Yeah, the impacts on the skin of and microbiome, right? DNA damage, ultraviolet radiation causes the formation of pyrimidine dimers, leading to what? Genetic mutations that can lead to skin cancer. So this is a very important key. Once those mutations have occurred, game over. A little skin lesion will always appear. You'll take your skin tissue, which could be on the corner of your nose, which could be under your eye, and it will mutate there and cause cancer, and that's fine. You'll go to the office, have it removed, and it will come back. Immune suppression, prolonged sun exposure compromise the cutaneous immune system, reducing the ability to defend against abnormal pathogens. You have an immunosuppressive activity when you get too much sun. So much so that sometimes sun improves psoriasis, for example, because you lower the skin's immunity a bit, but you don't need to get sun exposure either. So you take an immunobiological that solves it. Epidermal dysregulation, alterations in epidermal homeostasis, compromising cell renewal and skin barrier function. That's why it's important to hydrate and protect from the sun. Cutaneous microbiome, active participation in the defense and inflammatory processes of the skin. Categories of nutraceuticals. We have macronutrients, omega-3, potassium, magnesium, micronutrients, essential vitamins and minerals, carotenoids, polyphenols, bioactive peptides. Bioactive peptides have clinical effects. They have a 30% reduction in wrinkles, an increase in type 1 collagen and elasticity. So we have commercial products here like Verisol, Peptan, Celogen. They have demonstrated in consistent clinical trials a significant improvement in aging parameters. So a formula suggestion here using Verisol collagen as the active ingredient. Biotin 1500 micrograms, chelated copper 500 micrograms, chelated selenium 50 micrograms, Nutricolin 200, astaxanthin 4, Verisol 2 grams, capsule 1 unit. Take one capsule once a day, okay? Generally, this won't fit in just one capsule. It will be more or less 2 capsules, okay? 2 or 3 capsules for this composition. Then you'll take these 3 capsules all at once. If you don't want to take it in capsule form, you can also ask for it to be made in powder form, okay? Instead of putting it in a capsule, you put it in a sachet. A sachet, that's what this is. Yeah, the amount sufficient for one sachet. Yeah, nutraceuticals and cellulite. Yeah, a suggestion for what you can do between ultrapharma MPT sessions. It's a gel that you'll use, which has an activity to perform drainage, okay? Drainage and fat burning, let's put it that way. Then there's Centella asiatica, there's theophylline C, adipole hydroxyline C as well, a self-absorbing gel, botanical extracts, pycnogenol. Pycnogenol is extracted from the bark of the French pine, from Pinus pinaster. It is rich in bioactive compounds. The clinical benefits, well, studies show a significant reduction in the melasma area and skin roughness. It has multiple actions: antioxidant, anti-inflammatory, and brightening. They are rich in procyanidins, bioflavonoids, and phenolic acids, which act synergistically on skin health. So as a formula suggestion, we have pycnogenol 100 milligrams with Polypodium leucotomos. Take 1 capsule per day. We also have Pinus pinaster, which is the same thing as pycnogenol nattokinase. Yes, nattokinase 100 milligrams, dimples, which helps with cellulite capsule, 1 capsule per day, or pomegranate along with Pinus pinaster, which is also the same thing as pycnogenol, which are bioactive compositions that you can also be integrating for this patient who is for the actual treatment of the skin surface and for sagging as well. Carotenoids and photoprotection. So we have beta carotene, which is the precursor to vitamin A potent antioxidant action. It's what Trump uses, right? He has carotenemia. If you look, he's quite yellow. Not just Trump, but I think even his wife uses it too. You can see that there's a group of people in the United States who have a fixation. There is a condition where a person has a fixation, okay? An obsession with that tanned color, which is called tannorexia. So there are people who consume a lot of carotene, fruits, vegetables, everything to be able to get very red, very tanned. It doesn't get tanned, it gets that orange look, right? Lutein protects against oxidative damage and reduces skin inflammation. Lycopene, it's present in tomatoes, has an antioxidant and anti-aging action and photoprotective effects as well. So here, look, melasma and oiliness. An option that I put the active ingredients with the meaning of each one, okay? Here I put melasma and oiliness. We have ferulic acid 10 milligrams. It has an antioxidant action, resveratrol 5 milligrams, antioxidant and anti-inflammatory action. Ortica dioica is a plant with anti-inflammatory properties as well, and also regulates skin oiliness. Here we have turmeric or curcuma longa, 500 milligrams, also anti-inflammatory. It also helps with depigmentation, acts in the reduction of spots, in the control of this oxidative stress as well. In a capsule to take, in this case, it will be about 2 capsules a day, because it is a formula that is larger, miracle pens. So what can you be using along with the tisapartida, for example, right? Hydrolyzed collagen, it provides peptides that stimulate collagen synthesis, improving skin firmness, hydration, and elasticity. Resveratrol fights skin aging and modulates inflammation. Hexyl resorcinol, it had a bioavailable organic silicon that acts on the firmness and integrity of the cellular matrix. Hexyl resorcinol, you have to have it made at a good pharmacy, because hexyl resorcinol it's a registered trademark for organic silicon, okay? Yeah, so it's a brand that comes with the registered trademark R, and the pharmacy that actually passes this on to the customer has this seal. You can call the pharmacy and ask, do you have the hexyl resorcinol seal and such? Because if it's something very cheap, you can be sure it doesn't have any hexyl resorcinol in it. It must have something else in there, a generic. And asiaticoside, which it is an active ingredient from Centella asiatica that also stimulates fibroblasts and promotes dermal regeneration. And here I put one for the sad rich girl. Sad rich girl, right? Why? Rich girl, because it's a formula that isn't cheap, right, either. But here we have, but it's not that expensive either. I was just joking, okay? It's because it has 5-HTP, which is a precursor to serotonin. It contributes to emotional balance and sleep. Vitamin B6, an essential cofactor in various metabolic reactions, helps with hormonal regulation and skin health. Resveratrol 50, an antioxidant, protects against aging. Yeah, S-adenosylmethionine, a modulator of neurotransmitters and cellular methylation with action on mood and inflammation, 150 milligram dose. Passiflora, 160 milligrams, has a calming anxiolytic action, and it's a capsule, okay? Yeah, it's not just for sad rich girls. No, any patient who really needs, doctor, I wanted something to be calmer, but I also don't want to take Rivotril. I'm also against using that, okay? It's not good to keep using it all the time. It's very bad for you. Yeah, or they don't want to use another medication, right? So it's something more a calmer thing for the patient to be able to use. Coenzyme Q10, excellent, okay? It has an endogenous antioxidant action, acts on the mitochondrial respiratory chain, protecting cells against oxidative damage. People usually say, and I even think it's ugly to use this term, right? You have mitochondrial failure. Oh, for heaven's sake, right, guys? It's a scam, right? Mitochondrial failure. Yeah, a product you can buy ready-made that has coenzyme Q10 is Fascia Q10 from Biolab. You can just buy it ready-made too. I always prefer things bought ready-made, okay? So in addition to the anti-aging effect, coenzyme Q10 helps maintain skin viscoelasticity and firmness, improving its appearance and resistance to external aggressors. And the natural production of coenzyme Q10 decreases with aging, okay? It's particularly relevant after 40 years of age. So everyone over 40 can already take some coenzyme Q10. Polyunsaturated fatty acids. Here we have EPA and DHA. The brand name I suggest is SD Essential, okay, Nutrition. DHATG, one capsule, 90 units, excellent, okay? Mechanism of melasma. We know that in melasma, we have an activation of alpha MSH. So when you get sun on your whole body, your face gets spots too, okay? There are patients who say, oh, I applied sunscreen to my face, but the face gets stained anyway, even if you're getting sun on your body. Oxidative stress, we know it increases hyperpigmentation, the induction of metalloproteinases and reactive oxygen species, nitric oxide, all of this causes skin inflammation, and all of this will also lead to the activation of tyrosinase. So a suggested formulation for melasma here, we have BioBlanc 250, cerasamides 20, polypodium 250, and glutathione. Glutathione is a key active ingredient, okay, for us to be able to reduce this, to perform this antioxidant action, okay? Yeah, there are also complementary formulas that we can make. Antioxidant, so lutein, resveratrol, anti-oiliness, vitamin B6, niacinamide, zinc, hydration, lipoat, vinoshin, curcuma longa. Yeah, antioxidant capsules with lutein. Here we have then, look, lutein 20, alpha lipoic acid 30, and astaxanthin 4 milligrams. This here is a compounded formula that you can prescribe to your patient, and you can associate in this formula a little bit of crina, ferulic acid, resveratrol, and PQQ, 10 milligrams of PQQ and 10 milligrams of Floritin, creating a synergistic combination between antioxidants that fights free radicals through different mechanisms. The recommendation for this combo of these 6 active ingredients, right? It's 7 actually. It's 1, 2, 3, 4, 5, 6, 7. It's 8, right? Which is PQQ and Floritin 10, 10. Of these 8 active ingredients, then it can generally be taken with food, 1 capsule once a day. It's an antioxidant boom for the patient. Rosacea, right? Niacinamide reduces inflammation, strengthens the skin barrier, and improves the redness characteristic of rosacea. So you can also make this formulation where you include niacinamide 750, chelated minerals, in this case chelated zinc, copper, associated with folic acid and vitamin B6, all in one formula, 1 dose per day as well. Suggestion for melasma complete formula. I really like this formula here, this polypodium, glutathione, BioBlanc, Morosil, excellent for inhibiting melanogenesis as well. It works as an oral photoprotector. This formula is really very good. BioBlanc properties then, inhibitor of alpha MSH, anti-inflammatory action, inhibition of tyrosinase as well, and reduction of nitric oxide. Cerasamides also reduces oxidative stress, decreases collagen degradation, reduces inflammation. So it's a very key active ingredient for us to include in our formulations. In this suggestion here, we have BioBlanc with cerasamides and Lumeni C and Zin. Take 1 capsule a day for 3 to 6 months. And here, to wrap up this topic, there's a trend going viral right now in clinics in South Korea, whitening serum. Look how crazy that is, right? This whitening serum is nothing more than serum therapy using glutathione V. However, glutathione V in high doses can lead to kidney failure, liver failure, so it has to be something with very strict patient monitoring. And I am also always in favor of a lower dose. how some colleagues are already doing it in large clinics there in the United States and in Sao Paulo too, is they do the serum therapy with glutathione and also perform a laser treatment on the patient or do a chemical peel for the patient as well. Whenever the patient comes to the clinic, like doing one session per month for 3 months, okay? It's an option for you to maximize the effect by using this glutathione, but at a lower dose. So the dose is from 300 milligrams to 600 milligrams per session, which can be administered bi-weekly or monthly, okay? I personally prefer it monthly. Today, there are clinics in Sao Paulo where you get the glutathione IV or other active ingredients, and the patient is already getting a pedicure, a manicure. That's how it is, okay? It's all quick. In the United States, over in Orlando, Florida, the patient just calls, oh, I'm feeling a bit tired. Someone goes to your house and does it right there, gets an IV access, and administers the medication intravenously, okay? So there is this movement happening today. Yeah, and I think we shouldn't be left out. I think we can prescribe a few little things that we understand, that we check, and that have a better result. Glutathione, I think it's an interesting option, but with great caution and using more judicious doses.